This is actually my first Zoom meeting at home, believe it or not.
You cleaned up the dining room so you could have it there?
Oh, we never use the dining room, you know.
I know, neither do I.
No, I think I've eaten one meal in it the entire time we've owned the house. We've owned the house for 35 years, you know.
I feel
What's
like,
that, Jamie?
oh yeah, I never use it.
Yeah, never.
That's why it became a lot of people's office this past year.
Yeah.
What's the matter, Jeff? What kind of a code?
Hey, Chris, would you mind calling me right after this just for a very 30-second conversation?
The only one I can think of is maybe.
Chris.
30-second conversation, okay.
It'll only be 30 seconds. I'll put you on the clock.
Okay, that's,
I literally think that's
I do not believe that.
Who said that? Who said that? What?
it's important for you to have one.
Brian.
Oh, Brian? Oh, Brian. Hey, Brian, you know what we talked about just earlier? How dare you? What's that? Yeah. Thanks. Or 29, Gene.
Yep. What do you want me to do, a countdown?
No. I'm being on time today. I don't have a heck of a lot of information.
Yeah. They don't provide it till like tomorrow, right?
Well, I'm actually waiting for I'm actually waiting for some stuff right now from the
Okay.
league, which I thought I would have had by now, but I obviously don't.
All right.
But it's nothing that's really that germane. I
Yeah.
actually got some information for you, Jamie, on a question you had last week that just literally came in at 3:23. So
Oh, that's great.
Hey, Mr. Manager, it is 4:30. If you'd like to get started on the COVID meeting, please.
certainly, thank you very much, Madam Chair. I don't have a lot to report today, but let me provide. And the interesting thing, well, it's not interesting, but these meetings going forward with the Lieutenant Governor McKee taking the helm of the state as governor, I don't know what format he's going to follow going forward. I'm just going to assume that he's going to keep the same format, and hence maybe we can. But I'm just going to ask the council to be somewhat malleable with these meetings. I know that the league, Rhode Island League of Cities and Towns calls will continue. I'm not, for the second consecutive week, we have had no call with the governor's office, and we had calls with the governor's office the entire time during the pandemic. I think it's just a matter of the transition that they're going to go through. So we'll see. We'll see how things turn out. The numbers, actually, the interesting thing about the numbers, which is my next topic, is the numbers today are very interesting in that, let me just pull them up. The way the state determines its positivity rate, it's at 4.5% as of yesterday. When you just take the number of new positive cases and divide it by the tests on the prior day, it's a fairly simple mathematical equation. I'm not too sure what it means, but they would say it means quite a bit. And that 4.5%, we haven't seen it that low for quite some time. Additionally, and we'll keep our fingers crossed, the hospitalizations are down as of yesterday. They're at 375. As you all recall, they've been in the 400, 402, 405 range. And so that 375 is a good number. The number of the first dosages administered in terms of vaccine, right around the 39,000 mark, 40,000 mark. Number of people that have been second dosed, about 9,000. That's a total of 48,000 doses that have been administered thus far. And I'm going to talk about vaccines in a moment. The local numbers, at least as of last week, and I'm reporting you last week's numbers, are down as well. The adjusted number from the week before that on the RIDA website is 145. I think I might have reported it as 133. So they obviously added 12 new cases. That positivity rate at that time, if you took the number of tests for that particular week, our positivity rate was running about 7.5%. However, last week, which is the number I'm reporting you right now, the case count is at 118 new cases with 2,218 tests. So the positivity rate is at, simple 5%. You can compare that to, thank you very much, thanks. If you can compare that to, sorry, I had someone fixing a door in my house and I had to pay them. Sorry. You can compare that to Central Falls that had 130 new cases last week. They had 703 tests. That's still an 18% positivity rate. Middletown, 76 new cases, 5%. Portsmouth, 134 new cases. That's close to a 9%, 0.087. Overall, if you look at the RIDO website, they're trending us at overall number of tests compared to the number of cases we have at 6%. We're still at the bottom, by the way. And I think only South Kingstown and New Shoreham are lower than us. Any questions on the numbers? I think they're trending in the right direction, so we'll just keep our fingers crossed. Vaccinations. I don't have a lot of new information. I gave you a lot of information last week. Jamie, if you're still on, I know you put your picture up there. You asked about Donovan Manor last week, and I've been attempting to get that information since last week. But the positive is they do have proposed vaccination dates for Donovan Manor, the scattered elderly and disabled sites. Those tentative dates, and Rhonda Mitchell, who is the point person on this, is working through those dates. And Brian Dugan, who's on the line, probably doesn't know this either, but I just got this information. They are tentatively scheduled for February 2nd, February 23rd, and March 16th at those sites. So that's still a couple of weeks off, but that's a good sign. The interesting thing, if you listen to Dr. Scott comment at the press conference yesterday, and it was mostly the substantive information from Dr. Scott at the press conference. I think that Gina Raimondo, I'm not certain whether she's going to give another press conference in her capacity as governor next week, but obviously she's at the end of her term. But the biggest challenge, and it's no different than what I indicated to you last week, is the supply. The systems, the vaccination systems are all in place. Those are all ready to go. But Rhode Island is allocated and receiving approximately 14,000 doses a week. They've received overall around 72,000 doses, with 1,600 of those are siphoned off to CVS and Walmart for use at the congregate care settings. That has left remaining 55,000 doses that we've received, and Dr. Scott that said approximately 50,000 doses have been distributed. You might find interesting and so a lot remains to be seen thus far in terms of where we are with vaccinations. They're still working on the phase 1 dosing, and then little tidbits like I just gave you about Donovan Manor are starting to leak out. Next month, they're going to be hitting the older adult population. And when you think about the 14,000 doses that were being allocated, I think the number of that the state estimated that there were approximately 190,000 individuals in Rhode Island that are 65 and older. So you can see the daunting task and the challenge vis-a-vis the supply chain. Testing at, we have these 2 new testing sites in Newport, in addition to the Stop and Shop sponsored state site. Edward King House, the testing has been fairly robust up there. And so a lot of individuals are attending there, and it's the Binax rapid test, and it's worked out quite well. Carmela Gear, to her credit, has organized the volunteers up there, and she sends to Ryan Dugan and I updates after, well, she sent an update after the first dosages were just last week, but she had a lot of attendees, and hopefully that will remain. Brian and I have been speaking about perhaps he was approached by the National Guard about whether we could any other locations for testing sites in Newport, and Brian and I are making some determinations the next couple of days as to possible locations more towards out the north end of the city. The issue is going to be ultimately the volunteers to staff those that rapid test site, and so those are some logistics that Brian and I are talking about. And actually, I've included Angela. I don't think she's on the line in the loop. Just
I am. I'm here.
Since Angela has some synergy with some organizations out there, and I'll and any of you others that wish to participate. It's an issue of volunteers. So I'll be speaking further on that in the next couple of days with Brian about what we can do. I've asked him to go to the next step. If we make that decision that yes, we could use some other testing sites, then what's the next step? We just need to thresh that out a little bit more. Carmela has, and I'm going to reach out to Rhonda Mitchell tomorrow. Carmela has offered if there's a way to transport anyone that doesn't have any type of transportation to Edward King House, they would be happy to accommodate them in terms of testing. And the testing, by the way, that I had this conversation this morning, there is no charge for the testing. It's as easy as walking off the street, filling out they try to extract some information from you so they can, give you the results and get your name, your phone number, maybe an email address so they can tell you whether, just send you some follow-up information. But it's as easy as that. There is no charge. So that's a good thing. And there's no charge, by the way, at any of the state facilities. So I think that's a good trend. And it'd be nice if we had, at least in my mind, since we seem to have various areas of the city covered, we have the kind of the middle area. I maybe could say, from a convenience standpoint, you could say that the southern end of the city could use something, but also the northern end of the city could use something in terms of a test site. And when I say middle end, I'm talking about Edward King and the Baptist church that Lynn raised last week.
Joe,
Any questions?
Joe, what is the rate for the testing that they're giving for at Edward King Center? What is the accuracy rate?
Oh, it's the Binax. It's the Binax Now rapid test, and the literature will tell you that it's in the 90s.
It's
I don't have
in
the
90s. Okay, that's what I wanted to know.
I don't have the I actually did a little research on this a few weeks ago. There was, I think, a New England Journal of Medicine article on it that I came across, and the accuracy was impressive, or I thought it was, the number that it touted. I may be wrong on that. I'll double check that, Gene.
Okay.
But the more I don't think the state would be pushing it out. It wasn't an accurate test,
Right.
So I think that the testing is very accurate.
Okay.
I know that I could go on about it because, there are some caveats to it in terms of age inaccuracy. It's
Mhm.
not as accurate for people under 18 as it is for individuals over 18. And the article got into the weeds, and
Okay.
I'm not going to get into that right now. But I'll dig
Counselor-
out that information again.
Counselor Seikley.
Yes, can you? Am I on mute?
No, but you're
We-
quiet. You're on mute now.
Thank you. Carmela does have a volunteer, a network of volunteers, Joe. I don't know if you realize that
Yes.
she can.
They're pretty. It would be a heavy lift for them to do a different site. They're pretty well occupied.
Okay. I
Yeah,
wondered.
that's the first thing that came to mind with Brian. Brian Dugan, who's on the line, reached out to. And you can speak for yourself if you're not on mute, but I know you reached out to Carmela on the volunteer aspect. Are you there, Brian?
Yes, I am.
Okay.
So the
This is
question is,
Dugan.
Brian, is yes.
This is Brian Dugan speaking at this time, the fire chief for anyone that's out there. I did speak with Carmela about the volunteers. They are actually working twice a week, Thursday and Fridays, at the King House. And she's also working with us on the meds pod, setting up with that and gearing up on people to work when we start local vaccinations. So she's actually says it'd be a heavy lift trying to get more people because it's the same groups of people. So that's why she asked if we could try to get transportation to bring people to the King House, or if we can develop another segment of the population on the north end that can actually work in the area.
Brian, do you know if the people who are administering these tests, if they will receive vaccines? Are they sort of in the pipeline or first to get
For
No.
not for the Binex testing, not for that sort of thing. If you actually work at one of the meds pods,
Mhm.
which groups of volunteers that Carmela is actually has an ongoing list. If people sign up as a volunteer and you actually work some of these pods at the vaccination pods, I'll call them, you would be able to get in line. But Carmela has right now a list of probably 200 people that she works with regularly for the Red Cross and the Aquidneck Island Volunteers Alliance.
What is the difference between
We
the
ran that up the flagpole when we ran that question up the flagpole a couple of weeks ago, up the Rideau, in terms of the ability of the swabbers, if you will, to get vaccinated, and it just was, the answer was no, as a priority.
I'm sorry if I don't know. What is the difference between the med pods? What is that?
Well, the med pod is
What's happening?
a site that we will create hopefully at some time, and there are regional med pods right now that are vaccinating EMS workers and others. They're vaccination sites, if you will, versus testing sites. Testing sites are not med pod, but the med pods are the actual. At some time,
Centers.
we will be locating most likely a med pod, a vaccination sites in Newport. Brian's team is working on that. We are meeting as a team next week to go over where we are in the process. And that's when I talked about before, where Dr. Scott said the systems are in place. We are part of the system, or ultimately we will be part of the system when the vaccine becomes much more prevalent and robust. Municipalities are treated in the MedPod system as mini departments of health. So we will be on call, and we will be ready as part of the system in place to vaccinate individuals when the supply becomes much more prevalent.
Okay. And I just have one other question. I thought EBCAP was doing testing in the North End. Are they still doing that?
Brian, you would know better than I, but I believe that they are. But they're like a health clinic.
Right.
I don't know.
But anyone can go. Right. I think it. I don't think it's depends on income or anything like that. I think you could just go. Right, Angela? Am I correct? Angela's putting her hand up.
Yeah. Oh, yeah. I was like I'm back in school or something, right? So I think it's also important to distinguish how they're kind of doing the testing. So first of all, we're talking about timing, right? The difference between EBCAP and this established site that Joe is trying, Joe and Chief Dugan are trying to get together has to do with time and then also the method. So I've actually been, as part of my job, I am required to get tested every 2 weeks, and they are still using a method, the same method where, you have to go up to your brain, hold it for 10 seconds. Whereas I believe this rapid testing too is different in their method of how they're doing it. I don't think that it's required to go up that far. And again, there's an opportunity to get quicker results, and what's more is a good thing in this process, in my mind.
Yes, I was going to say it's the Buy Next Now rapid test, and the difference is the site up at Edward King House is a walk-in site, as is the Baptist Church is a walk-in site, meaning you just show up. You don't have to make an appointment. You don't have to call ahead. They'll get as much information out of you as they can. It's not only a different test, but it's a different format.
I understand. I just wanted to make it clear that there's still testing going on in a place in the North End. So, okay, thank you.
Angela, did you
So
have
Stop
any
and
more
Shop's
questions?
available. Excuse me, Jane. Stop and Shop is available as well, still as a test site.
Okay.
And their method of testing, I think, is more accurate, or what I'm told is more accurate than Buy Next too.
It's through the portal, but you have to go through the portal.
So lots of different variations is my point, and I think that's a good thing. But also, I'm gonna try to do a shameless plug here too. If somebody was thinking about volunteering, what's the expectation in terms of the need for a volunteer? Like, what would they be expected to do?
Well, that's a great question, because that's the question I asked of Brian, and we were talking about that this morning. Is there isn't a heavy lift in terms of volunteering. It's a long day, and there's just some paperwork involved. But it's like train the trainer. We need to find out. I mean, Carmela is the ultimate volunteer coordinator, and she knows the system. So we will consult with her as to the characteristics of what's needed in terms of the characteristics and the time and the lift of the volunteer. But for the most part, it's simply taking the information that when one comes into the facility, the name, rank, and serial number, and then that's it. That's all they really have to do. But I don't know in terms of what else, Angela, but that's basically what it is.
Counselor Bova?
Oh, I'm sorry. Just for continuity purposes, I think Chief Dugan, did you want to weigh in as well?
I just wanted to mention to you that with the volunteers, there are different things that we are looking at, and we're going to actually put something out. I'm going to be talking with Tom Shevlin on whether we can get something on our website, city's website, to collect the names of volunteers, and then we'll get that over to Carmela, so then she can actually send out information when we need people. But so volunteers, greeters at the door, so that we can actually check temperatures, see if anyone has a cough, the basic work screening that we do right now. The next spot would be people that are monitoring to move people along, the workflow, to direct them to certain locations, signing people in. Most of this is going to take place online. So when you show up, you'll have a time that you can show up at the site. This is how we're doing it at the regional pod right now. You can check in. We'll make sure to have name, address, your IDs. Then it goes over to a physician. We have to have a physician and a pharmacist at every one of these pods. Then it would be the people that are actually doing the vaccinations. So once the vaccinations, we'll still have people move along, check you out, then people to monitor you after you receive a vaccine. So we're looking at 25 people anyway per day in each of these segments. So if we're doing 4-hour blocks, we're going to need 50 people a day plus. So that's where we are. And Carmela is actually coordinating the collection of all these names, where we actually just started yesterday sending information out to collect names of physicians, nurses, and pharmacists. So we're getting ready to move into the next phase of collecting names. We have had people already sign up, take actually classes online to review what they need to do or actually get familiar with what a MedPod is. And then we collect those names, we get those over to Carmela and she takes care of it. So just so you know that if people show up to one of the MedPods at the start of the day, we have just-in-time training, and we actually go over everyone what their jobs are, what their responsibilities are, so they actually have an idea what's taking place or what they have to do during the day. And so it's not like they're going to be a deer in the headlights. They'll know exactly what's going on.
Just so we're clear, Brian's talking about vaccinations. I think, Angela, your question had to do with testing,
okay.
but Brian, thank you for jumping in on the vaccinations aspect and explaining the difficulty and the lift that a MedPod is involved in, and because it is a fairly heavy lift. I've taken the course. I'm a volunteer, so that it's going to be we need a lot of people.
Okay. Councilor Bova?
Thank you. My question is kind of along the same lines of what we've all been talking about. When we're asking for volunteers for the test sites, are we asking volunteers to administer the tests or just for the administrative part of it?
It's the administration. It's all the things that Brian said, that, the greeters, the people directing you in the line. If depending upon where we have it, it might be some people out in the parking lot directing traffic, where to park, and things like that.
Yeah.
The vaccinators are professionals that are trained in it.
And the testers.
Yeah, the test, Brian, could you explain on the testing? I confirm that, please, as well. Those are not, volunteers do not administer tests. Those are administered by trained personnel.
That's correct. This is Brian Dugan again. Yes, National Guard. I spoke with Carmela about this afternoon, trying to find out how we go about expanding to the north end. The National Guard would send down testers, med tech technicians would actually be doing the swabs, all those sort of things. The volunteers, which at the site at the King House, I think there's 12 volunteers outside of beyond the numbers that the National Guard are providing. So they will take down the names, addresses, all that information, and move people along through the site.
Okay, thank you. I just wasn't clear on that distinction.
Yeah,
Okay.
also super important question, because some people probably would interpret that they have to do the nasal swabs. Yeah.
Understood.
So have any of you been through the Binax? I mean, I have not been through the Binax. I've gone through one of the earlier rapid tests in the PCR. So Brian, I know you and I discussed that this morning about the swabbing of the Binax. Could you maybe just ride that again for everyone. I think you did.
Yeah,
at least.
so the Binex, I've actually had both done. The PCR, which is the long swab that Councilor McCallum mentioned earlier, goes much deeper up the nasal cavity, whereas the Binex will go in maybe 2 inches, swab both cavities, nasal cavities, and then it's basically as simple as them taking that Q-tip swab, sticking it into the test kit with some reagent on it, and waiting 15 minutes. It's pretty simple test.
Okay, great. Thank you, Brian. You look too comfortable there, Brian.
That's okay. I'm
Did I
in
lose
front of my
someone?
fireplace.
Yeah, you look pretty good, comfortable. Good for you.
Well, I took the video off.
Madam Chair, that's all that I have today. I'm more than happy to try to answer any further questions, or I wanted to confirm one other thing. I know Charlie asked me last week, and I did confirm it by email, about what some type of certificate or confirmation in writing if you have a negative result at one of these rapid test sites like the Edward King House. And the answer is yes, you do get something in writing as well as an email.
Okay.
It lags a couple of days, but you still get it.
Okay, thank you. If there's no other questions, I guess, until you get your next update, Joe.
Sure. I'll probably shoot you some information tonight, since I'll get, I think we'll get something from the league that,
That's what I
Vida
was
was
gonna ask. I
owed-
think the league will continue their efforts.
yeah, Rido owes some information to the league to be disseminated to us. And if
Okay.
I get any more recent information, I'll shoot it to you all.
Okay. Thank you. Thank you, everybody.
Great. Thank you.
Be safe.